Hello beautiful people, welcome to my YouTube channel called Priscilla Empire. Here we'll talk about health and wealth, and you know that both of them are vital for you, so please don't forget to subscribe to my YouTube channel, on the notification bell, and give me a thumbs up, and always share my content. Yes, so in this video I'll share with us my second trimester challenge. Yeah, you all know that I'm pregnant. I'm very pregnant, so I'll be sharing some of my challenges, my second trimester challenges. In my previous video I talked about my first trimester challenges, and in this video I'll talk about my second trimester challenges, and in my subsequent video, in my next video, I'll talk about my third trimester challenges. So don't forget to subscribe. On the notification bell, and always share. Yes, you know, if you want to walk through these paths, you have to learn from those that have walked through the paths. I think you will learn one or two from this video, and if you have walked the paths, you equally learn one or two from the video. So in my second trimester I had some challenges. Yes, for the people that preach that second trimester is that, well, maybe it's relatively, maybe it was better than the first trimester relatively, but it had its own challenges. For me, it wasn't just like absent of the discomfort. In fact, it was a whole new level. So I remember from my 16th weeks. So from my 16th weeks, 16th week post my last period, I started noticing that I would wake up in the morning and my hand would be so numb. I couldn't, my hand would be so numb, and it was giving me pains and concern. And I was like, okay, numbness of hand. When I went to work the next day, you all know that I'm a medical laboratory scientist. So when I went to work the next day, I have to check my sugar level. I was like, maybe my sugar level is high. I didn't even expect it to be low. I was expecting maybe it's high. So I checked my sugar level. It was 68. It was 68. And it wasn't, I think I've eaten before checking my sugar level. I've eaten my breakfast before checking my sugar level. So it was a random, so I checked my random sugar level. Random, not fasting blood sugar level, but random. I've eaten my breakfast, I've eaten that day. So I got to work and I checked my sugar level, and it was 68 milligram per dl. It was 68 milligram per dl, and that's like on a low side. It was in a low side because the normal should be 80 and above, and I was having 68 milligram per dl. So I was like, wow, maybe what is causing that numbness is because I'm not getting enough energy. So in fact, I have to, even on my own, decide to be taking Sprite. Sprite is a soda. So I said to be taking Sprite or ORS to get energy. That was what I said to do. And so the doctor said that I had carpal tunnel syndrome. Yes, carpal tunnel syndrome. That's what is causing the numbness in my hand, and it have nothing to do with my sugar. Though he equally sent me for tests to evaluate my sugar. So he sent me for OGTT test. So, and that came out normal. It wasn't high, it wasn't low. It came out normal. So he told me that the issue is that I have carpal tunnel syndrome. So I did my he told me that there's nothing I can do about it, that I'll just have to manage it till it will go after the pregnancy. It will stop after the pregnancy. So the doctor said that the numbness will stop after delivery, that I just have to manage with it. In fact, I have to complain. And he said it not even gets better, it will get more intense. Even I came back home, I did my research, I was just on YouTube watching videos of that, and I get scared the more. I was in pain, and you're already telling me that the pain will keep increasing till I deliver. It was, and honestly, it was like every week, every day, they keep intensifying. In fact, I remember during that period, I'll wake up sometime early morning, I will cry my eyes out. In fact, shortly, just 1 month after that 16 weeks started, just within 1 month of within 1 month of the doctor telling me that I have carpal tunnel syndrome, my Samsung phones got spoiled because if I try to hold it, that's like my main line. My main line was there, so if I try to hold it to answer call, it's in fact in a day it can fall off my hand like several times. I can't even count. Several times, like within 30 minutes, it's always falling off from my hand, and the screen of that phone spoiled. So I was like, yeah, now I understand this situation. So it was a terrible, even sometimes in the night I'll wake up because of my hands were very numb, and there is nothing like sleep again for me. That numbness will not even allow me to rest or sleep. It was that bad. It was bad. And all the hopes of having an easy second trimester. I was like, is this going to happen? This easy second trimester? It's how will I put it? I didn't believe the easy second trimester, because that carpal tunnel syndrome was like, it was like everything in first trimester put in one. So, well, other things apart from that numbness of my hand, other things was easier for me. In my second, I was more energetic. I was eating better. Indigestion was there too. Yes, the second challenge in my second trimester was indigestion, but this one now pro-mass, indigestion pro-mass, now came with heartburn. Yes, the indigestion now came with. The second challenge I had in my second trimester was heartburn and indigestion. Both of them are now related, so they came together. They reinforced. Like indigestion went to carry him brother come. So the only thing I try to manage that, I try to eat things that works for me. You know, when you are getting used to indigestion, you know the things you should eat and some things you should not eat. Like eba, if I dey eat eba, I go dey eat small, no longer plenty. Eat small, so I to go in. Then if I eat it, I will not know the things that I will do after that will make it digest easily. So that was how I was coping with that. That was not much. It was a concern though, because they had one. It was a concern too. But in my second trimester, the challenges I had was that carpal tunnel syndrome and indigestion and heartburn. So the part of them also happened to be carpal tunnel syndrome, and it keep getting worse and intensifying by the day, by the week. In fact, as I'm talking to you now, if you touch my wrist, it's very painful. If you touch it, just literally touch it, so it's very painful. I can't do anything. I can't lift. I can't hold something for long. Something as small as my phone, I can't hold it for long. I can't open the cap of some things. Even at work, for me to do some things, I will just call for help, and they will do it for me. They'll be like, this one don't delay you, but they don't know, saying I suffer, now pains person they use. So that's my main challenges in my second trimester: carpal tunnel syndrome and indigestion and heartburn. Yes, you have come to the end of this video. Please don't forget to subscribe. This is an educative channel where you learn one or two. Yes, and our focus is on health and wealth. If you are not talking about how to make money, how to make wealth, we are definitely talking about health, and these are vital information for you. So don't forget to subscribe, on the notification bell, and give me a thumbs up. So in my previous video I talked about my first trimester challenge. You can go and watch the video, and in my next video I will equally talk about my third trimester challenge. All right, don't forget to subscribe. See you in my next video. Bye for now.